Hello class, my name is Myles and today I will be presenting on Rett syndrome. Rett syndrome is a rare genetic neurological and developmental disorder that affects the way the brain develops, causing a progressive inability to use muscles for eye gaze and body movements in speech. It occurs almost exclusively in girls, however there are rare cases that it does occur in boys as well. It is characterized by normal development through the first few months of infancy, but then the regression of language and motor skills occurs. Children with Rett syndrome may exhibit autistic behaviors such as impaired social interaction, impaired communication, and unusual repetitive behaviors. Signs and symptoms of individuals who have Rett syndrome are respiratory functions are impaired, feeding functions are impaired, children lose their ability to speak at around the ages of 12 to 18 months, as well as muscle dystonia within their hands. They have difficulty washing their hands, clapping, or clasping on objects. Seizures usually occur, sleep disruption. Their cognitive skills are also impaired. And the main component of language that is usually affected with someone who has Rett syndrome is their pragmatic skills. Target strategies to help SLPs with individuals who have Rett syndrome and their pragmatic skills are impaired are establishing consistent eye gaze using high interest objects, photos, or symbols, increase wait time to allow the individual to respond, ask questions and make comments throughout communicating with the individual, and establish this as a daily routine. My communicator profile is a rare case. It's a African American male named E.B. who is 5 years old, who presents with autism, Rett syndrome, and a mild case of dystonia. He is nonverbal, however, he does vocalize his wants, his needs, and his behaviors through vocalization of vowels. All his components of language are affected since he is nonverbal, and he is not able to move his right hand because of his muscle dystonia. I recommend two AAC devices for him. It's a mixture of a low-tech and a high-tech. The first one is low-tech sign language. This can help with memory, recall, vocabulary, joint attention skills, as well as natural gestures and hand movements when communicating his wants and needs to his caregivers, family, teachers, and his speech language pathologist. Advantages of this is that it's low cost and it's efficient to use within EB's natural environment. The next AAC device is a high-tech. I recommend an iPad. He can use this within his school setting to interact with his peers. And the application that I would recommend using on his iPad is the Tobii Dynavox Compass application. It already comes with preloaded memory, age appropriateness, vocabulary, messaging, symbols, core word strategies, and support such as voice activation. This application can serve to meet most of EB's communication needs, as well as provide a foundation for customized programs. Advantages of this device is that it will spark EB's interest more since he likes to use technology day to day. A disadvantage of this is that it is high in cost. It is about $180 plus the usage of an iPad that you have to buy as well, which is around $700. I hope you enjoy listening to my presentation. Have a great day.